What is coronavirus disease? Coronavirus disease 2019 (COVID-19) is a respiratory illness that can spread from person to person. The virus that causes COVID-19 is a novel coronavirus that was first identified during an investigation into an outbreak in Wuhan, China, around December 2019. The threat from this virus, worldwide, is very significant. Dr. Richard Hatchett, CEO Coalition for Epidemic Preparedness Innovations, has referred to the virus as a war. I'll say it is a global war, a war waged against all of humanity. Epidemiologists say that the potential of the virus in terms of attack rates globally could be between 50 and 70% of the global population. This shows how much responsibility each one of us has, if we are going to fight this thing. To be able to take this responsibility, we must have some basic knowledge of the virus. How it is spread, how to prevent it, what to do if we think we might have been exposed or gotten infected. How is coronavirus disease spread? 1. Person to person. The virus is thought to spread mainly from person to person. Being in close contact with an infected person within about 6 feet or about 2 meters. Through respiratory droplets produced when an infected person coughs or sneezes. These droplets can land in the mouths or noses of people who are nearby or possibly be inhaled into the lungs. 2. Contact with infected surfaces or objects. It may be possible that a person can get COVID-19 by touching a surface or object that has the virus on it, and then touching their own mouth, nose, or possibly their eyes, but this is not thought to be the main way the virus spreads. The virus that causes COVID-19 seems to be spreading easily and sustainably in the community spread, in some affected geographic areas. Symptoms. Reported illnesses have ranged from mild symptoms to severe illness and death for confirmed coronavirus disease cases. The following symptoms may appear 2 to 14 days after exposure. Fever, cough, shortness of breath. There is currently no vaccine to prevent coronavirus disease. The best way to prevent illness is to avoid being exposed to the virus. However, as a reminder, CDC always recommends everyday preventive actions to help prevent the spread of respiratory diseases, including, avoid close contact with people who are sick. Avoid touching your eyes, nose, and mouth. Stay home when you are sick. Cover your cough or sneeze with a tissue, then throw the tissue in the trash. Do not do what this guy is doing. Clean and disinfect frequently touched objects and surfaces using a regular household cleaning spray or wipe. Follow CDC's recommendations for using a face mask. CDC does not recommend that people who are well wear a face mask to protect themselves from respiratory diseases, including COVID-19. Face masks should be used by people who show symptoms of COVID-19 to help prevent the spread of the disease to others. The use of face masks is also crucial for health workers and people who are taking care of someone in close settings, at home or in a health care facility. Wash your hands often with soap and water for at least 20 seconds, especially after going to the bathroom, before eating, and after blowing your nose, coughing, or sneezing. If soap and water are not readily available, use an alcohol-based hand sanitizer with at least 60% alcohol. Always wash hands with soap and water if hands are visibly dirty. These are everyday habits that can help prevent the spread of several viruses. Treatment. There is no antiviral treatment for COVID-19. People with COVID-19 should receive supportive care to help relieve symptoms. For severe cases, treatment should include care to support vital organ functions. People who think they might have been exposed to COVID-19 should contact their healthcare provider immediately. What to do if you are sick? Stay home, except you are going out to get medical care. People who are mildly ill with COVID-19 should be able to isolate at home during their illness. You should restrict activities outside your home, except for getting medical care. Do not go to work, school, or public areas. Avoid using public transportation, ride-sharing, or taxis. Separate yourself from other people and animals in your home. As much as possible, you should stay in a specific room and away from other people in your home. Also, you should use a separate bathroom, if available. Restrict contact with pets and other animals while you are sick with COVID-19, just like you would around other people. Although there have not been reports of pets or other animals becoming sick with COVID-19, it is still recommended that people sick with COVID-19 limit contact with animals until more information is known about the virus. When possible, have another member of your household care for your animals while you are sick. If you must care for your pet or be around animals while you are sick, wash your hands before and after you interact with them and wear a face mask. Call ahead before visiting your doctor if you have a medical appointment. Call the healthcare provider and tell them that you have or may have COVID-19. This will help the healthcare provider's office take steps to keep other people from getting infected or exposed. Wear a face mask when you are around other people, sharing a room or vehicle or taking a bus, or pets, and before you enter a healthcare provider's office. If you are not able to wear a face mask, for example, because it causes trouble breathing, then people who live with you should not stay in the same room with you, or they should wear a face mask if they enter your room. Cover your coughs and sneezes. Cover your mouth and nose with a tissue when you cough or sneeze. Throw away used tissues in a lined trash can. Immediately wash your hands with soap and water for at least 20 seconds or, if soap and water are not available, clean your hands with an alcohol-based hand sanitizer that contains at least 60% alcohol. Clean your hands often. Wash your hands before eating or preparing food. When using hand sanitizer, ensure to cover all surfaces of your hands and rub them together until they feel dry. Soap and water are the best option if hands are visibly dirty. Avoid touching your eyes, nose, and mouth with unwashed hands. Avoid sharing personal household items. You should not share dishes, drinking glasses, cups, eating utensils, towels, or bedding with other people or pets in your home, if an infection is suspected. After using these items, they should be washed thoroughly with soap and water. Clean all high-touch surfaces every day. High-touch surfaces include countertops, tabletops, doorknobs, bathroom fixtures, toilets, phones, keyboards, tablets, and bedside tables. Also, clean any surfaces that may have blood, stool, or body fluids on them. Use a household cleaning spray or wipe, according to the label instructions. Labels contain instructions for safe and effective use of the cleaning product, including precautions you should take when applying the product, such as wearing gloves and making sure you have good ventilation during use of the product. Monitor your symptoms. Seek prompt medical attention if your illness is worsening, e.g., difficulty breathing. Before seeking care, call your healthcare provider and tell them that you have, or are being evaluated for, COVID-19. Put on a face mask before you enter the facility. These steps will help the healthcare provider's office to keep other people in the office or waiting room from getting infected or exposed. Ask your healthcare provider to call the local or state health department. Persons who are placed under active monitoring or facilitated self-monitoring should follow instructions provided by their local health department or occupational health professionals, as appropriate. If you have a medical emergency and need to call 911, notify the dispatch personnel that you have, or are being evaluated for COVID-19. If possible, put on a face mask before emergency medical services arrive. Discontinuing home isolation. Patients with confirmed COVID-19 should remain under home isolation precautions until the risk of secondary transmission to others is thought to be very low or insignificant. The decision to discontinue home isolation precautions should be made on a case-by-case basis, in consultation with healthcare providers and state and local health departments. Stigma and resilience. Public health emergencies, such as the outbreak of coronavirus disease 2019, are stressful times for all people and communities. Fear and anxiety about a disease can lead to social stigma toward people, places, or things. For example, stigma and discrimination can occur when people associate a disease, such as COVID-19, with a population or nationality, even though not everyone in that population or from that region is specifically at risk for the disease. Stigma can also occur after a person has been released from COVID-19 quarantine even though they are not considered a risk for spreading the virus to others. Some groups of people who may be experiencing stigma because of COVID-19 include persons of Asian descent, people who have traveled, emergency responders, or even healthcare professionals. Stigma hurts everyone by creating fear or anger towards other people. Stigmatized groups may be subjected to social avoidance or rejection, denials of health care, education, housing or employment, physical violence. Stigma affects the emotional or mental health of stigmatized groups and the communities they live in. Stopping stigma is important to making communities and community members resilient. Everyone can help stop stigma related to COVID-19 by knowing the facts and sharing them with others in their community. Communicators and public health officials can help counter stigma during the COVID-19 response. Maintain privacy and confidentiality of those seeking healthcare and those who may be part of any contact investigation. Quickly communicate the risk or lack of risk from associations with products, people, and places. Raise awareness about COVID-19 without increasing fear. Share accurate information about how the virus spreads. Speak out against negative behaviors, including negative statements on social media about groups of people, or exclusion of people who pose no risk from regular activities. Be cautious about the images that are shared. Make sure they do not reinforce stereotypes. Engage with stigmatized groups in person and through media channels including news media and social media. Thank healthcare workers and responders. People who have traveled to areas where the COVID-19 outbreak is happening to help have performed a valuable service to everyone by helping make sure this disease does not spread further. Share the need for social support for people who have returned from China or are worried about friends or relatives in the highly affected regions. Together, we can be able to at least reduce the rate at which this virus is spreading. Thanks for watching. Subscribe for more videos and for updates on the coronavirus.